Back to our channel. Today we are going to start anterior abdominal wall. So first we are going to start with the surface landmarks of abdomen. So actually in the anterior median plane, if you see, the abdominal wall is extending from the scaphoid process over here, which lies at the level of ninth thoracic vertebra. So like T9, you can see at T10 means this is a T9, that is representing the scaphoid process, right? So from here it will start to the pubic symphysis, which lies at the level of coccyx. So you can see here, over here this is the pubic symphysis. So till here this all region is called as abdomen. Okay, so from T9 vertebra to the pubic symphysis, this region is called as abdomen. So about this region today we are going to start. It's actually anterior median plane of abdomen, which lies at the level of coccyx here posteriorly and laterally. Next, the vertical extent of the abdominal wall is less, as it is replaced by thoracic cage above and behind, and by the gluteal region on the posterior aspect of the lower part. You know the gluteal region will be on the posterior lower aspect on back side, right? So coming to the superior lateral margins of the anterior abdominal wall, they are formed by the right and left costal margins. Each margin is formed by 7th, 8th and 9th, 10th costal cartilage. So superior lateral part is formed by this costal cartilage, and the costal margin reaches its lowest level in the mid axillary line. So the axilla will be here. So if you draw an imaginary line, that would lead to formation of mid axillary line, right? And here the margin is formed by 10th costal cartilage. So at the mid axillary line, you can take the 10th costal cartilage, that will form the margin for it. And the transverse plane as passing through the lowest part of costal margin is called subcostal plane. You can see here this is called as subcostal plane, which is just passing transversely lower this rib, right? Transverse plane passing through lowest part of costal margin is subcostal plane. It passes through the third lumbar vertebra. You can see L3. It is passing through third lumbar vertebra. So next, coming to the infrasternal angle or subcostal angle. Actually this scaphoid process area only represents the infrasternal or subcostal angle. Actually it is formed between the right and left costal margins. You can see one of the costal margin here. So the same will be on the opposite side. So between the two costal margins you will find this angle. And the scaphoid process, you can see it's lying in the depression at the apex of infrasternal angle at the level of 9th thoracic vertebra. So scaphoid process is at the level of T9. Okay, and next coming to the iliac crest. Actually iliac crest, here's the iliac crest and this inguinal ligament. This is a anterior superior iliac spine, right? So iliac crest forms the lower limit of abdominal wall at the side, and the highest point of iliac crest lies at the level of 4th lumbar vertebra. So this lies at the level of L4, slightly below the normal level of umbilicus. You can see just like normal level of umbilicus, below it you can find here the iliac crest. So anterior superior iliac spine lies at the level of sacral promontory. So actually in the sacrum, body of first S1 sacrum here will have the anterior surface that is called sacral promontory. So just exactly at the line of the sacral promontory you will find the anterior superior iliac spine. Okay, next coming to the tubercle of iliac crest. It's like about 5 centimeter. It's situated like on outer lip of iliac crest, about 5 centimeter behind anterior superior iliac spine. So this is anterior superior iliac spine. Just 5 centimeter behind it you will find the our iliac crest tubercle, and the intertubercular plane passes through these tubercles. So actually as you have tubercle on this side, on the opposite side also have. So if you join that line, it will form an intertubercular plane, and this passes through 5th lumbar vertebra. So these are some important points which we need to remember. He will write down here intertubercular plane, at 5th lumbar vertebra. So this is one of the landmark of abdomen. Next coming to the spermatic cord. So you can see here this is a spermatic cord, which is a soft rounded cord present in the male. It can be felt through the skin as it passes downwards near the medial end of inguinal ligament. So this is inguinal ligament. To the medial end you will find the spermatic cord. It enters the scrotum you can see here, okay, the outer, this is testis, so around it there will be scrotum. So enter the scrotum and can be picked up between the finger and thumb and palpated. In this way, a firm cord-like structure is felt within posterior part of spermatic cord. So posterior to spermatic cord also you will feel a cord-like structure, and this is the ductus deferens. So remember, posterior, so this is spermatic cord, so posterior to it also you will feel a cord-like structure, that is called as ductus deferens. Okay. And next, coming to the anterior abdominal wall. So actually this anterior abdominal wall is divided into right and left halves by a vertical groove. It marks the position of underlying linea alba. So actually the line which is drawn here in the middle, this is called as linea alba, and this is dividing the abdominal wall into right and left side. Okay. Next, coming to a little below the middle of median furrow, there is an irregular depression or elevated area called umbilicus. So this is an umbilicus irregular depression. It lies at the level of junction between third and fourth lumbar vertebra. So it's like in a junction between L3 and L4. Next, coming to few centimeters lateral to median furrow, that is the umbilicus. The abdominal wall shows a curved vertical groove in the upper end, reaches the costal margin at the tip of ninth costal cartilage, and inferiorly it reaches the pubic tubercle. So inferiorly it reaches the pubic tubercle, and this line is called linea semilunaris. So you can see this line, this is called as linea semilunaris, which is coming few centimeters lateral to median furrow, and it is showing a curved vertical groove. In the upper end it is reaching the costal margin at the tip of ninth costal cartilage. Inferiorly it reaches the pubic tubercle here, and this line is called linea semilunaris. It is corresponding to lateral margin of muscle called rectus abdominis. So linea semilunaris forms a lateral margin of rectus abdominis muscle. Next, coming to transpyloric plane. So actually it will be here. Let us draw it. So this plane is called transpyloric plane. It is an imaginary transverse plane, often referred to in anatomical description. Anteriorly, it passes through tips of ninth costal cartilage, and posteriorly through the lower part of body of first lumbar vertebra. This plane lies midway between suprasternal notch and pubic symphysis. So it's a pubic symphysis here. Actually, somewhere over here like this it will be, because this is the ninth costal cartilage, right? So you can see here the tip of ninth costal cartilage is here, right? So what they're saying, the transpyloric plane is an imaginary line to an anatomical description. Anteriorly it passes through tips of ninth costal cartilage, and posteriorly through the lower part of body of first lumbar vertebrae. This plane lies midway between suprasternal notch and pubic symphysis. So the line will be here. This is transpyloric plane, and it is roughly handbreadth below sciphisternal joint. And next, coming to the angle between the last strip. The angle between the last strip and outer border of erector spina is known as renal angle. So somewhere over here will be the renal angle, and it overlies the lower part of kidney. The 12th rib may only be just palpable lateral to rectus spinae, or may extend for some distance beyond it. Next, coming to the posterior superior iliac spine. So this is the anterior superior iliac spine. So just below to it you'll have the posterior superior iliac spine. Actually, this region it will be. It's like 4 cm lateral to medial plane. So this is the medial spine, just 4 cm lateral to it, somewhere over here. Okay. Next, coming to 3 transverse furrows may be seen crossing the upper part of rectus abdominis, corresponding to tendinous intersections of muscle. One usually lies opposite to umbilicus, and the other opposite to the free end of scaphoid process, and the third midway between the two. So actually what they are saying, there are 3 transverse lines drawing, one here, other will be here, and next one will be here. So like this, the 3 lines are crossing the abdomen. So that's it. This is all about the surface landmarks of anterior abdominal wall. Next we'll start with the skin, superficial fascia and the deep fascia.